My name is Shelly Berman. I'm a 74-year-old retired teacher from Pittsburgh, Pennsylvania. I am, in my retirement, a docent at a museum of natural history. I've been a certified teacher for 35 years in the Pittsburgh Public School. I'm certified kindergarten through 12, and I have taught all grades. I have a Bachelor of Science in Education from the University of Pittsburgh, and I have a Master's in Math from Carnegie Mellon. I was a patient in a hospital having spine surgery. I found after my retirement and after traveling just a little bit that I had severe back pain. It grew from minor. Someone said it was the hip, another doctor said no, it was the spine, and eventually found out it was the spine, and had spinal surgery, thought about it for a while, and decided that that was the answer. And I had spinal surgery with fusion. After the surgery, I was sent home. I went through the surgery beautifully. It was fabulous. I had state-of-the-art care, marvelous hospital, marvelous surgeon, marvelous physicians and nurses. Nothing could have been finer. I came home, and within 3 weeks, I became ill. I had to have a blood test. And they took me to an outpatient facility for a blood test, and I could barely get into the place. They took the blood test, and when I was walking out, I had to hold on to the walls and the car, and I had a caregiver with me at the time, and my family member who was driving the car. And when I got into the car, I could not sit up. Couldn't hold my head up. That's how weak I was prior to getting to the hospital. They took me back to the hospital through the emergency room, and I went through triage, and they admitted me, and they thought that I was a sick puppy. And it was an infection of some sort. They took care of that. I came through that. I don't know what the name of that infection was, but I was so weak when I was taken home that I had to wait to go back to the hospital in about 3 weeks to have the wound, the original wound from the spinal surgery, reevaluated and taken care of. I was taken back to the operating room after the 3 weeks, after I had recuperated for the 3 weeks from the infection. I was back in the hospital, same hospital, marvelous state-of-the-art care, and they took me. That's when I went back and they did the surgery that cleared the wound. And they did the surgery and kept me under observation through the night and did not discharge me until the middle of the following morning. I understand my surgeon was one of the very first, state-of-the-art, to use the vancomycin powder. And he was very concerned. My spinal surgeon came every day to make sure that I understood what had happened. It was a very slow recovery. I found I was very weak, extremely weak, very fragile, unable to walk more than a half a block without the use of a cane. First it was a walker, then it was a cane. And I had been fine up until 3 weeks after the initial surgery. I was walking beautifully, no cane, no nothing. It wasn't until after the infection that I had to start using a cane again and a wheelchair to get from a long distance, like an airport. It was impossible for me to get from the baggage claim to the plane or to the front door rather than without a wheelchair. It has taken 8 months from that infection period until I was able to feel, I am able to now feel like I did maybe well before the surgery, before there was any pain at all, when I had no pain at all. So it's 8 months of recuperation and rehab. And I feel fantastic. No pain at all. I have none. I couldn't believe it. In fact, said to someone very near and dear to me, you know, something's really wrong with me. I can't figure it out. And he said, well, what do you think it might be? And I said, something's wrong. Something's missing. And then it dawned on me. I was not in pain. I have not been in pain for about 15 years. But after this fabulous experience with the fusion, the spinal surgery and the fusion, I am now pain-free, totally pain-free. I have 2 grandchildren, and I adore them. And I have 2 quasi-grandchildren next door to me at my home. So I have little ones and medium-sized ones, and I love children, and I spend a lot of time with them, and I'm now able to move around with them. I wasn't. I couldn't walk my youngest to school because I couldn't walk. Now I walk her to school and pick her up and walk her home. I am very much involved with the public sector in my retirement, and I'm enjoying every minute of it. But not being able to walk meant that I was limited to what I could do. At this point, because I also have certification in special education, I am able to use that to deal with people with special needs in the museum. And that's an area that many people are not able to do, and I want to be able to do it as well. Was the greatest improvement in my life. It has made my life totally pain-free. There are no excuses. You can't say my back hurts, my hip hurts, my legs hurt. None of it.